Hello everyone. So the next is question is number 23. So what do we have? An unconscious patient present with moist skin, shallow breathing. There are signs of previous injection on the shoulder and hips. BP 110 by 70. Tonus of skeletal muscle and reflexes are increased. Cramps of muscle of extremities are seen. What is the most likely disorder? So we have some specific signs. Okay. Here, moist skin, shallow breathing, previous injection of the shoulder. Okay, previous injection of the shoulder. So he is taking some kind of injection, and tonus of skeletal muscle and reflexes are increased. Okay, that's all. So we have hypoglycemic, hyperglycemic, hyperosmolar, and lactic and stroke. So I think we can exclude one answer very quickly. That is stroke. We don't have any focal symptom. Okay, so stroke is not in contest. So we have four type of coma. So basically, if we think previous injection in shoulder and hips, the patient may be taking insulin injections. Okay, and if insulin injection, the side effect of insulin injection can be, as we know, it can be hyperglycemic. Okay, or hyperosmolar. It should be hypoglycemic, but we will talk about these things in a little more details. How can we differentiate between them? So if you apply common sense here, your answer is hypoglycemic coma. But you need to confirm. Okay, you need to know the things in deep. So first one is our hypoglycemic coma. Then we have our hyperglycemic coma. Then we have hyperosmolar coma, and last one is hyper lactacidotic coma. So how can we differentiate between these four comas? Okay, so first one is here, it is caused by hyperinsulin. Okay, excess insulin. It can be from the body, mainly from exogenous insulin injections, and hyperglycemic, it is caused by low insulin. So as I said, if insulin is high, so insulin he is taking, if he is taking insulin, then it is your sort hypoglycemic coma. First one. Then how can we differentiate? Hypoglycemic, it is always rapid onset. It's slow onset. These two are slow to moderate. Okay. Here breathing is normal or shallow. And the skin is pale and sweating and moist. Here what we get? We get air hunger. we get hot and dry skin. Here also try turgor. Okay, it is caused by hypoxia. Here also extreme hyperglycemia and dehydration. So here, what is imbalance between glucose production and excretion in urine? Okay, so hyperosmolar. So imbalance between glucose production in liver and excretion. Excretion in urine. So it is hyperosmolar condition, which is hyperglycemia. Okay, so these three are a little bit symmetrical. This one is different one. Okay, these two mimic hyperglycemia. Okay. So as you see, increase insulin, rapid onset, shallow breathing, moist skin. We have moist skin, shallow breathing, injection history. Okay, so this is our hypoglycemic coma. In stroke, as I said, we will have focal deficit. It can be two ways. One is TIA, transient ischemic attack, or we can have hemorrhage. Okay, as you see, these three are hyperglycemic state. And we will get dry skin. That's all. So next question we have from infectious and little non-specific type of question. A patient was admitted to the hospital on the 7th day of the disease with complaints of high temperature, headache, pain in muscle, especially in the calf muscle, dermal integuments and sclerotic or icteric. So there is jaundice. There is hemorrhagic rash. So we have hemorrhagic rash, we have jaundice, urine is bloody, hematuria. The patient was fishing 2 weeks ago. Okay, what is the most likely diagnosis? So we need to know about the diseases first. Okay, so what diseases we have here? We have leptospirosis, yersiniosis, salmonellosis. Leptospirosis, first one is leptospirosis, second one is yersiniosis, third one is salmonellosis. Salmonella. Okay. Then brucellosis and trichinellosis. Okay. Chart number brucellosis, and fifth one is trichinellosis. So some specific things. Okay, So leptospirosis, what happened? High fever, high fever, then dies. We can have abdominal pain, then hemorrhagic rash, hemorrhagic rash, then jaundice, then the legs. Okay, these things. Then in the urinosis we have gastro problem, gastroenteritis. Then we have pseudo appendicitis. Okay, pseudo appendicitis means you will get all the symptoms of appendicitis, acute appendicitis, like right lower quadrant pain, but it is not true. There is no appendicitis in real. Okay. Then erythema nodosum. Erythema nodosum. Then reactive arthritis. Reactive arthritis we can have. Okay. Salmonella, it is totally the problem. Salmonella, it's totally gastro problem like abdominal pain, cramps, okay, diarrhea, hepatomegaly can happen. Okay. In brucellosis, we can have mild fever, then sweating, enlarged lymph nodes, enlarged lymph nodes, enlarged lymph nodes. Then weight loss, weight loss, okay, and trichinosis. It's not so much important, okay. Here, remember brain affected, okay. Like you will have symptoms of affecting brain, periorbital edema, retinal hemorrhage, okay, heart lungs involvement, okay. So now some things like its carrier is rats, okay, leptospiro, and so leptospirosis, it is spread by rats, but you know it can enter through any body opening. So if you swallow in if you swim in shallow water where animal urine can contaminate the water, then it can enter your body through any openings. Okay, okay. So yersiniosis, it is associated with pigs, and brucellosis, it is milk. Okay, and it is through trichinosis, it is through uncooked meat. Uncooked meat. Okay, so let's get back. So here we don't have any history of pig or something else, so we can yersiniosis we can get out. We don't have any GI symptoms. Salmonellosis no, brucellosis there is no history of drinking milk, no history of drinking uncooked meat. we have jaundice, we have hemorrhagic rash, we have hematuria, and we have history of fishing. Okay, so our answer here is leptospirosis. Actually, none other cause hemorrhagic rash. Okay, so it's specific leptospira. Hemorrhagic rash. Okay. Then next one. A 60-year-old woman, mother of 6 children, develops a sudden onset upper abdominal pain. Sudden onset upper abdominal pain radiating to the back, accompanied by nausea, vomiting, fever, and chills. Subsequently, she noticed yellow discoloration of the sclera and skin, so jaundice. On physical examination, the patient was found to be febrile with temperature of 38, along with right upper quadrant tenderness. Okay. So, in carcinoma of head of pancreas, we don't get right upper quadrant tenderness. Malignant now we have choledocholitis, choledochal cyst, and benign biliary structure or malignant biliary structure. So, what are biliary strictures? Okay, sorry, it's stricture. So, what is benign stricture? So, here in stricture will get some non-specific sign, non-specific plus jaundice plus leukocytosis. Okay, choledochal cyst, it's mainly in infants. Congenital, it is congenital. Then we have conjugated bilirubin. Better we write hyperbilirubin. Conjugated hyperbilirubin anemia. Okay, and we can get abdominal mass. Okay, so we don't have any history of infant, congenital, conjugated hyperbilirubin, abdominal mass. So choledochal cyst can be our answer. So benign biliary structure and choledocholithiasis. In choledocholithiasis, what are the symptoms we can get? In choledocholithiasis, we can get symptoms of fever. Okay, then jaundice, toxic syndrome, then right upper quadrant pain. So these two are we can say DDX hour. Okay, so but you see here in biliary structure we will not get any temperature increase. Okay, we will not get the toxic syndromes. In choledocholithiasis we will get the toxic syndrome like temperature, nausea, vomiting. Okay, these things. So we can differentiate between stricture and choledocholithiasis by this. But how do we differentiate? Let's add a little bit. Benign stricture and malignant stricture. So benign stricture, it will be smooth, symmetric, and malignant, it will be irregular, asymmetric. Okay, that's all. So our answer is choledocholithiasis. Next question. So this question is in Krok. Some questions you will get that it is very non-specific. Okay, you cannot understand the questions. You have to just memorize it and write it there only. Okay, you will not get anything like this in clinicals or something. Okay, so See this question. A 42-year-old woman suffers from bronchial asthma, has an acute attack of bronchial asthma. What medication from the listed below is contraindicated to render a first aid? So here they are asking a first line drug. So these drugs are not like any of them are not for bronchial asthma in first line. Okay, morphine you can use as a painkiller. Okay, but euphylinum it is used in bronchial asthma but as a second line. So you have to remember these things. So first line we used what we used saba, short acting beta agonist, or lava, or corticosteroids. Okay, these things we can use to relieve the bronchial asthma patient when he or she approaches us. So if these drugs don't work, we have theophylline, euphyllene like this. So second line drug. So it is not our first line drug. Okay. Next one, a 62-year-old patient complaining of enlargement of cervical, supraclavicular, and axillary lymph nodes, subfebrile temperature for the last 3 months, has been admitted to a hospital in blood WBC. Okay, lymphocyte 72%. What method of study should be used to specify the diagnosis? Okay, so what is like here you have leukocytosis. Okay, so what we can think about this enlargement of cervical, enlargement of the lymph nodes. Okay, subfebrile temperature for last 3 months. Okay, so we can think about two diseases here. First one is TB, and second one is leukemia. So for DDX, what we should do? We should do a blood serum profile. Okay. Okay. Second one for TB, we can have a myelogram. Differentiate this. Okay. So here they are suspecting a TB which is situated in the spinal canal. Okay, so for that we can have myelogram, as we can check the whole spinal canal anatomy. Okay, here X-rays, thermography are not useful here. Okay, so here you have to do the DX, and so first one we should do serum test. There is no information here or option here, so then we can go for myelogram. Okay, next one is a 38-year-old complains of purulent distress from left nostril. The body temperature is 37.5 normal. The patient has been ill for a week and associated with her illness with common cold. Common cold associated with illness with common cold. Okay, there are pain and tenderness on palpation of left cheek. Okay, important one. The mucous membrane of the left nasal cavity is red and turgid. The purulent exudate is seen in the middle meatus in maxillary. They have given the answer only. Okay, so they are saying here all these. They are saying the maxillary, middle meatus. So you can straightforward answer yours should be maxillary sinusitis. Okay, so but we need to learn a bit also, not only doing MCQ. Sorry for my drawing. Again, okay, it's very hard to draw in computer. So as you know, we have facial sinuses. So if this is the nose and these are the eyes, sorry, I think is hyperthyroidism. Okay, so we have a sinus here, okay, on both sides. Then we have a sinus here also, and a sinus. Okay. So what are these? These are this one's maxillary. Great. This one is in the headache. Sorry, in the forehead. So it is frontal, and this one is ethmoidal. We also have sphenoidal, but it is underlying in this area. Okay, so you cannot see this. Okay, so you can see the sinus which is underlying the cheeks. It is our maxillary sinus. Okay, beautiful one. So palpitation cheek, left cheek. Okay, now one more thing, we should learn about the meatal opening. What we should learn? We should learn the meatus. Meatus are openings which are in our face. So we have superior meatus, we have inferior meatus, and we have middle meatus. Now we will see which sinus trends where. Okay, so in superior meatus we have posterior ethmoidal. So in superior meatus we have posterior ethmoidal sinus drainage. In inferior meatus we have nasolacrimal duct opening. In middle we have anterior, sorry, we have anterior and middle ethmoidal sinus, and we have maxillary too, and frontal sinus. So this thing runs a lot of. So as you can see, maxillary sinus, it's middle meatus, as they have seen, middle meatus, maxillary sinus. So it's acute purulent maxillary sinusitis. Okay, next one, and I think the last one for this video, the complication of acute cholecystitis which requires surgical intervention as follows, except. Okay, so we need to see the things which are indicated for surgery. MPM of gallbladder, yes, it is indicated, it's serious condition. Emphysematous of gallbladder, we need to cut out the gallbladder. Okay, gallbladder perforation, emergency. Cholangitis condition by the presence of stones in bile tract, also emergency. Okay, jaundice, a non-specific sign. So we can have time to check what happened there, and we can also do some medical management. Okay, so it is not a indication for